Okay, everyone, can you hear me okay? I don't know. Maybe I'm just looking for the panelists to tell me that they can hear me okay. All right, that sounds great. Well, thank you, everybody, and thanks for coming here today. Welcome to the Friday Huddle Extended Cut. This is the that we are going to be having with Senator Jeff Merkley. For those of you who don't know me, my name is Jana Bitten. I'm with the Oregon Center for Nursing. And just for those of you who actually don't know about the Oregon Center for Nursing, let me tell you about that really quickly. We are the state's Nursing Workforce Center. We are a nonprofit organization that was started in 2002, specifically to look at Oregon's nursing workforce and really try to get a sense about what's happening in Oregon's workforce. How do we know that we have the workforce that we need to support all of the healthcare needs of the people who live in the state of Oregon? So, more than 20 years ago, nurse leaders from around the state came together and formed this nonprofit organization that partners with all other organizations in the state to really look at the data that's related to the nursing workforce in our state and also trying to collaborate and bring everybody together to be able to problem solve and be able to address some of the challenges that we face. As part of that, one of the things that we're able to do is we have something called the Friday Huddle. So if you are also on this call and you're from the Friday Huddle, way to go, huddlers. Really great to see you. Glad that you came and joined us on a Tuesday, since that doesn't really jive with the Friday Huddle. But for those of you who haven't been part of the Friday Huddle before, this is a weekly call that we do every Friday morning from 8 until 9 a.m., where we're just checking in with everybody. We have a very loose agenda. It's kind of one of my favorite events because I don't know what we're going to talk about. I have a list of things, but most of the time I'm just kind of waiting for the people that are there. And it's been a really amazing opportunity for us to be able to connect with the nursing community across the state. And it was actually because of what we've been talking about in the Friday Huddle that really led us at the Oregon Center for Nursing to reach out to Senator Merkley's office. Because one of the things that we have been noticing over the past several months is there have been many changes that have been introduced related to Medicaid and Medicare health policy changes, the many things that are happening at a federal level. It's really, really hard to keep up with all of those things. A lot of those changes that will be taking place are going to impact the nursing workforce. And it feels like we're just trying to peel that onion back a little bit. And as quickly as we're able to peel off a layer of the onion, another layer gets formed. So about a month ago, we got together a Friday Huddle Extended Cut where we talked specifically about the nursing workforce and what these changes might be in the state. And we were able to hear from our Office of Rural Health and really kind of get a idea about what is happening. And it was after that that I started to think, it would be really great if we could hear from an elected official, somebody who is at the front lines of trying to not only understand the policy, but really help shape the policy that's going to be in the best interest of Oregonians. So this is why I reached out to Senator Jeff Merkley, and he very graciously agreed to join us. The problem is that his schedule changed and he is going to be here at 1:45. So if you are here and you're only able to make the first 15 minutes, I'm so sorry. His schedule changed. He had to come a little bit later, which is going to be okay because we will be recording this. So, and we will be posting this on our YouTube channel and our website and all of that. So you'll still get a chance to hear what he has to say. He'll be coming very, very soon. In the meantime, though, I'm going to stop sharing my screen. I invited a couple of people that are regular huddlers to join us today because I wanted to kind of get a sense from them about what their experience is with the changes and kind of what's kind of happening for them. So today with me, we've invited Jamie Smith, who's with the Multnomah Education School District, and Nicole Bennett, and I had to write this down, who is with Willamette Health and Wellness. Jamie's going to be able to give us a perspective about what is happening in the school nursing side of things. And also, Nicole, I'm hoping that she can look at it from a couple of different lenses, both that of a small business owner and also a nurse practitioner, and also with psychiatric patients and what that's doing for their patients. So right now, again, while we're getting started, let's turn it over to Jamie. Jamie, tell me a little bit about what is happening as far as the federal policies and the things that are happening HR1 that was passed this last summer, some of the things that we hear about on the news. How is that impacting you and your workforce and the people that you and the students that you serve? And because of this, I'm going to ask you to unmute and hopefully that will work. Yes, go for it. Thanks, Jamie.
Perfect. Thanks for inviting me, Jana, and happy to be here to talk a little bit about school nursing. Really quick, Jamie Smith, Senior School Health Services Administrator at Multnomah ESD. So we provide school nurses and school health assistants for Multnomah County public school districts, and a little bit beyond Multnomah County as well. So the goal of school nursing is always to remove health-related barriers to education. So trying to identify what those health issues are that would prevent either the student having full access to their education, or what supports they may need to make sure that they can receive their education at the same level as their same age peers. So that's always our goal from a school nursing lens. And some of the things that you may not know necessarily about school nursing in Oregon is that we every school nurse is sometimes responsible or overseeing 2,000 to 3,000 students in multiple school buildings across the school district. Some areas are a little bit better than others, but if you think about our diverse state, certainly there's a lot of variation of what that school nursing model looks like, and a lot of implications that we are seeing as kind of theoretical things. And my office is right by the airport, so you're hearing some jets go over, so sorry about that, but we'll do our best. Some of the things we're not experiencing directly yet, and some things we are. Some things that we are just apprehensive, concerned about that may come towards us over the next year or so. The one thing that I think is more immediate is that because of overall district budgets, we are already seeing some nursing positions in schools being reduced because there's only so much money to go around. And school districts have to decide, am I going to focus on class size? Am I going to hire a math teacher, or am I going to have another nurse? Right. And so there's sometimes a lot more political pressure to make sure that those class sizes are smaller, or there's enough sections of whatever subject to be able to meet the needs of that community and those students in the school. And so we are certainly already seeing across the state some reduction of positions based on the educational funding in Oregon. And to add to that, the uncertainty of educational funding at the federal level, and what that then translates down to the local level in Oregon, and how districts have to make decisions based on that uncertainty, or last minute change of this grant goes away, or this pot of funding from the federal government changes, or requirements change, or that type of stuff. So we are seeing that already across the state of Oregon. And it's not a new thing with the ebbs and flows of education in Oregon, but certainly the uncertainty at the federal level is kind of adding to that anxiety and kind of decision-making level at that side. The other thing is just the concern over protections of students with disabilities. There's a lot of whispering and a lot of discussion on, the Federal Department of Ed and what that means of, is IDEA, or the Individuals Disabilities Education Act, is that going to still exist in the same format? Are there still going to be the same requirements that support that? And along with that comes a small carve out of Medicaid money that schools are able to access to get Medicaid reimbursement for some of those services we provide, to make sure that those kids that qualify for special education can access their education fully. So things like nursing, things like speech therapy, things like physical therapy, occupational therapy, different services like that students need to be able to access their education. There currently is a pot of money that schools can access that's totally separate from OHP and other Medicaid sources. But is that going to be secure as a funding source? And in Oregon, we've identified that as a strategy to try to overcome the lack of dedicated funding for those school health services. And so we're putting a lot of effort into getting this system figured out but is that all going to be worth it in the end if something at the federal level changes to either change the requirements or the criteria for that reimbursement or something like that. The
See,
other thing I go ahead.
this is why I was like so excited to have you, because this is the thing is we talk about Medicaid changes, we talk about health policy, but you also get kind of you're taking it from a completely different lens with the with education, and that's impacting you too.
Yeah, it's all intertwined in the world of school nursing. It's really, we're that bridge between health and education. It certainly is amplified at these times when things outside are impacting the work that we do for sure.
Yeah, excellent. Well, thank you. I'm going to wrap up because I want to make sure that we get to Nicole.
Of
Thank you
course.
so much for sharing that perspective and sharing that story. I know that I saw a post on LinkedIn a couple of weeks ago where the American Nurses Association President Jennifer Menzick Kennedy, who's also an Oregonian, was saying that, our lawmakers need to hear these stories. So I appreciate you sharing your story, Jamie. And also for everyone else here, just so that you're aware, the questions that we're going to be asking Senator Merkley when he arrives, those are pre-approved. So we sent out a survey and had everybody put together a survey about, had everybody put together a survey about what they wanted to ask him, and we pre-approved those questions. So we're not going to take questions right now, but what we are going to do is you are absolutely welcome to go over into the chat and add any kind of comments that you want. If you heard something that Jamie said and that kind of spoke to you, put something into the chat. We want to definitely hear about that. All right, it looks like Senator Merkley is here, but I do want to hear from Nicole because we promised her that she would have a chance to say something. And I don't want to disappoint Nicole Bennett because Nicole Bennett is one of my favorite people in the world. So before we go to the Senator, Nicole, can you just tell us from your perspective, as someone who is a nurse practitioner and a small business owner, what are some of the things that you are doing right now to try to combat the uncertainty that you're experiencing? And I am going to have to ask you to unmute.
There
There
we
you
go.
go.
Yeah. I'll try to nutshell it for
Okay.
time, but it's interesting to listen to you talk, Jamie, because there are so much of what you said. There's a parallel with the provision of outpatient mental health care. It's just like Jana said, just a slightly different lens. And just for those of you listening, I'm a owner of a small outpatient behavioral health practice. We have 24 clinicians, 12 are therapists, 12 are psychiatric nurse practitioners doing psychiatric evaluations, med management, and some therapy. And there are lots of things to talk about. I think the impact on patients, the concern patients have with some of the federal um, uh, changes, risks to
Mhm.
patient privacy. There are many of those things that I think I could talk a lot about. Right now, I'm really focusing on talking to people about what it means to be a small to medium sized medical practice and
Yeah.
what the risks potentially are to us during this time. And I think the insecurity of knowing what's coming in the future, if payments
Yeah.
are going to get delayed. We had some delays in payments from federal payments to Oregon a few months ago that luckily didn't hit us. But really, I want folks to think about what that might mean for all the smaller medical practices that are out there that don't have the kind of funding that OHSU legacy big organizations have.
Right. Right.
That we know these things are going to get settled out, but we're going to have a lot of bumpiness along the way. And we want to make sure that we stay in business, that we're able to weather the storm. If anything taught us Change Health last year, the disruptions that happened with medical claims were very risky to a lot of businesses. And some medical practices went out of business. And that was a blip compared to what could potentially be happening in terms of not knowing what we might be getting paid, how we might be getting paid, and when we might be getting paid is concerning. And we're really trying to shore ourselves up right now for that. My extra money in saving, line of credit, really trying to consider, can we take more Medicaid patients? Right now we see about 35% Medicaid, and we want to keep doing that, and we want to see more, and we don't want to limit that, especially at a time when there's already going to be limitations to patient care.
Right.
But
Right.
we have to be able to survive through all of this. And I think that's the biggest thing that's on my mind and what we're preparing for right now, Jana.
Thank you. See, that's another thing. You have a completely other lens. And we can't, if there's anything that we can take away from nursing as a profession and nursing as a workforce, it's that the lenses that are impacting the nursing profession is not just healthcare. it's small business, it's education, it's kind of all over the place, which is, thank you very much for your perspective, Nicole, thank you, which is why we asked Senator Merkley to join us today. So Senator Merkley, let's get you on camera right now and make sure that you can be unmuted. So thank you so much for joining us. While you're getting all set up and kind of settled in, Senator Merkley, just wanted to first introduce myself. I'm Jana Bitton with the Oregon Center for Nursing, and with you today, all of the people that are kind of the invisible screen right now are Friday huddlers. There's a lot of people who come in on Friday, and we have a weekly call where we check in about the nursing workforce. The reason why we were hoping to hear from you is it's come up very often in that conversation about concerns that people are having around the uncertainty around healthcare policy and some of the things that are coming out of Washington, D.C. And I was wondering, could you kind of speak to that for a few minutes, just so we can kind of get your perspective of where you're at?
Jenna, I would be happy to, and thank you for the invitation. And I appreciate everybody joining the conversation about healthcare and about nursing. As many of you know, my wife Mary is a nurse, and my son Jonathan is a physician assistant. And so I hear from both of them how difficult a time it is to be a healthcare practitioner, but a particularly difficult time to be a nurse. Just as soon as it felt like we were getting to get back on track after the massive disruptions of COVID-19, now we face enormous new challenges from Trump and the Republicans with their so-called big, beautiful bill. I call it the big, ugly betrayal because it does terrible things to families. It's a families lose and billionaires win. And I call it a betrayal because Trump didn't campaign on a families lose, billionaires win agenda. But just down the hall from here in the rotunda, we saw on swearing in day where his real, I guess, core philosophy is, because he wasn't surrounded by champions at the inauguration for healthcare or housing or education or infrastructure investment or environmental cleanup or equality of opportunity or anything like that. It was a set of billionaires. And sure enough, his, big agenda bill was all about, well, devastating programs that serve families, particularly healthcare, in order to fund tax breaks for billionaires. Kicks more than 15 million Americans off their health insurance. That number is probably just burned into your minds. And one of the things it does, of course, is Oregon Health Plan, or Medicaid, as is known across the nation. But it does a lot of things to that program. But it also immediately lowers the value of the Affordable Care Act tax credits that help families buy insurance. So Oregon families are looking at a reported expected change of about 68% increase in the cost of out-of-pocket for health insurance, about $1,300 a person. And according to new estimates just released yesterday, and I have a chart, I'll just wave your direction. Didn't do anything fancy like put up a scene, but an example for a couple in their 60s from Hermiston could pay as much as $25,000 more per year to secure health insurance. That's a couple in their 60s. And of course, the cost of healthcare gets higher as you get older. And we know that when the cost goes up, many people are forced to go without insurance. They can't afford to see a doctor, or they'll delay or skip care, skip maybe the meds, put off going to the doctor in the first place, maybe wait till there's an emergency and go to the emergency room. And in that case, when patients come in, they're going to be a lot sicker and harder to treat. And it's also just a lot more expensive for the system. And the big ugly betrayal bill, it slashes Medicaid. And 1 in 3 Oregonians are on the Oregon Health Plan, are Medicaid. And a stunning 60% of Oregon's children are insured through Medicaid. The estimate is that the changes to Medicaid in the bill will cut over 200,000, the estimate is 238,000 Oregonians off of their Oregon Health Plan coverage. That's incredible. I mean, it's just devastating. Not just devastating to those families, that lose health insurance, but it's devastating to the hospitals and clinics that will not have the revenue that comes in when they can pay for the health care they need. And it's devastating to the state in that the estimate is they'll lose about $2 billion a year due to Medicaid funding cuts and increased administrative costs. The Shep Center at the University of North Carolina estimates that 300 rural hospitals will be at risk of closure because of Medicaid cuts. Maybe they won't close completely. Maybe they'll shut down core programs, maybe expensive programs like maternity care, which we've already seen is a real challenge. When you have a rural hospital that shuts down maternity care and the next birthing center or maternity care is 100 miles down the road, that's really a scary situation for our expectant mothers and their families. So, and just realize it's not just hospitals, it's also rural clinics. When we saw Medicaid expansion, we saw services go up at a number of our clinics in Oregon, but the reverse will happen under this bill. And I'd like to say it's a bill that hasn't passed yet, but it is now law. We'll be fighting to reverse it, but if we don't succeed, these are the consequences. In 2023, about 2,000 Oregon nurses practiced in rural hospitals funded primarily by Medicaid. In addition to rural hospitals, the other providers who will be hit hardest are the long-term care providers and nursing homes. Again, 2 years ago, the stats that we have, 4,300 Oregon nurses practice in long-term care settings, primarily funded by Medicaid. Clinics, community health centers, behavioral health providers, as I mentioned, will suffer. And roughly 2/3 of the adults who receive outpatient treatment to support recovery from opioid addiction, they're funded by Medicaid as well. Where are they going to turn without support? It takes a lot of effort to escape that type of opioid addiction. And the hospitals and clinics that manage to stay open, they'll be stretched thin. What happens with that? Well, hiring freezes, fewer nurses, being asked to work longer shifts, more overtime, covering more patients. That's a recipe for burnout. With burnout, nurses may go from full-time to part-time or go on to on-call or retire completely, leaving even more stress on the system. So it can be a spiral that really does a lot of damage. Now, right now, we're just 2 weeks away from September 30th deadline to fund the federal government for the next year. And this is an opportunity for us to make some big changes. And I'm fighting to make sure that this funding package ensures that families can afford health insurance. We'll be pushing to reverse some elements, hopefully a bunch of elements of the big ugly betrayal of the bill. And I'm also championing legislation to support the nursing workforce that I can discuss in more detail later. For now, let me just say, these are pretty tough times. We're in an enormous period of fluctuation. It's kind of fasten your seatbelt, stay in close touch with your advocates, stay in close touch with those of us who are serving, and hopefully we can find the best path to a very rough period for our nation and certainly a rough period for healthcare.
Yeah, thank you so much. I'm really glad that you talked about the maternal health because that's definitely something that has been brought up a lot at our huddles and just something that we've been experiencing in Oregon. And we've had a lot of discussions about how in some of these gaps, they are going to be turning to the nursing workforce to fill in some of those places. So we're trying to make sure that we've got everything kind of ready for that, you know? So one of the questions that came through that we wanted to check on is the first question that I wanted to ask you is, how do you plan to uphold Oregonian values such as transgender care, women's right to choice, public health in the face of this national legislation? There's a lot of fear of retaliation and a cut to funding. How do you reassure Oregonians that their rights to care will remain intact and that hospitals will be supported to continue to offer those services?
Well, thank you. None of these questions are easy.
No.
But I think about President Lyndon Johnson, who during the civil rights reforms of the mid 1960s. He said, freedom is the right to share fully and equally in American society. And when you ask or mention Oregon values, I think this is a national value to share every person having a chance to share fully and equally in our society. And that certainly includes the freedom of our transgender neighbors to receive the medical care they need. Includes freedom for doctors and nurses to provide medically necessary care to their patients. Includes freedom of all Americans to make their own medical decisions without politicians intruding into the privacy of our exam rooms. You know, it's like, Uncle Sam, get out. You don't belong here. Get out of this exam room.
Exactly.
But we've seen Congress and the courts try to force their way in on transgender care, on abortion, on vaccines, on public health. And so I'm fighting against that effort to put government in a place where they're telling us how to deliver healthcare or how we as individuals access healthcare. But when I was Speaker of the Oregon Legislature, we passed the Oregon Equality Act, and I championed it, and that led to Senator Kennedy asking me to lead an Employment Non-Discrimination Act, the major equality legislation when he was, he knew he was suffering from the brain cancer and knew he was passing on civil rights battles onto the next generation. And then we passed it through the Senate, by the way. We passed the Employment Non-Discrimination Act with more than 60 votes, bipartisan support. And then I partnered with our national groups to lead the National Equality Act, modeled very much on Oregon's Equality Act. And I introduced the No Place for LGBTQ plus Hate Act, which would block Trump's hateful executive orders that target LGBTQ plus Americans. And as Oregon's representative on the Senate Spending Committee, it's called the Appropriations Committee, I've led a group of 40 senators to oppose anti-LGBTQ plus and anti-abortion policies. So there's three things that I say to folks, because the folks who represent you in Congress can't do it alone. It takes an outside force and it takes an inside force. So at my town halls, people say, what can we do? I say, get off the couch, fiercely hold your elected leaders accountable, and join an affinity group, because to be angry and frustrated alone is to be depressed and ineffective. And to be angry but organized with others is to be energized and effective. And we need to be energized and effective during this period. You're the experts. Your stories are powerful. So please keep sharing them and keep pushing us to try to right the ship on healthcare.
Yeah, thank you so much. And I apologize. I was just notified that the chat was disabled and the Q&A is disabled. If there's anybody that would like, even though our questions have been pre-approved that we're going to be talking to the senator about, if there's any kind of reaction that you'd like to put in the chat, you are welcome to do so, and we can forward some of those reactions to the senator's office after that. So hopefully that is working now. Another question that Senator Merkley that was asked is, Oregon continues to make a push to maximize federal reimbursement through school Medicaid for students needing various health services support to have full access to their education. Is this reimbursement source at risk? And if so, what needs to happen to protect it?
Well, let's start by reemphasizing that 60% of our children in Oregon are in the Oregon Health Plan, nearly 500,000 kids. So there's a good news, bad news situation here. The good news is that the bill, the big ugly betrayal of a bill, does not specifically target school Medicaid. But the bad news is that the overall Medicaid cuts mean less funding could be available for school-based health services. Current estimates are that cuts to Medicaid mean that Oregon will lose about $2 billion a year. Well, that's a hell of a lot of funding for healthcare around the state. And of course, a very large number, some 200,000 plus individuals are at risk of losing their health insurance just from Medicaid, but there's other factors working there as well. So school-based systems will be under even greater pressure to provide health care, but we may have even less funding to support it. And one of the things that isn't being talked about so much is in 2028 through 2032, there will be a decreasing cap on provider taxes or provider fees that provide Oregon's match for the federal Medicaid system. So what is that going to mean if that stays in place and we can't raise the money inside the state to provide the match? Well, that's when the whole entire program, a lot of factors would have to be cut out. So it's a few years down the road, and so a little less talked about, but I wanted to mention that as well, because that's really a dagger pointed at the heart of the state match that is so essential to get the federal funds and could do even more damage than the types of numbers that I've been describing. So good news, it's not targeted directly. Bad news, the impacts on state funding and federal funding for Medicaid could really do damage to our ability to support those school-based clinics.
Very good. Okay. Thank you for that. And then another question. Someone wrote, my team specifically works with Medicaid recipients that are usually defined as high-risk pregnancies, either due to social determinants of health or comorbidities that impact their pregnancies. Can you speak to how federal cuts will impact those patients' access to home visiting programs that improve birth outcomes and health outcomes, such as Nurse-Family Partnership or Family Connects?
You know, these programs are so important. And even with them, we have higher complications, more deaths during birth than any other developed country, or at least that's my memory of the stats. You all probably have that in your head, and I think that's at least close to accurate. Medicaid covers about 40% of all births in the U.S. And if you go to rural communities, it covers about half of all births. So everything we're talking about in terms of the attacks on Medicaid should set off alarm bells, because you have higher risk of units closing. We had the maternity care close in, over in Eastern Oregon.
Yep.
And there's been discussion of losing the ones in Seaside and one other city on the coast. So I think that's postponed for at least a year for now, but they're expensive. And so that is, and it was Baker City, and 2 years ago where we lost that maternity ward, and mothers there will have to drive 70 miles, or their family members will have to drive them 70 miles. I think about them trying to do that down I-84 in winter during a snowstorm or a freezing rain or something, and it's just not good. We are one of 17 states that has that Family Connects model, which provides in-home care from nurses trained not only to assess newborns, but also to keep the whole family in mind. And the other program, the Nurse Family Partnership, it's shown proven results, significant improvements in health and lives of first-time moms and their children. I was talking to a nurse the other day who is employed in this world and does regular home visits for first-time moms, and the coaching on is so important to the health of the baby and the health of the mother as well. So how could we as a society possibly cut these core programs? But back to the pressure of, if we see these devastating cuts to funding, there's going to be cuts in many, many places. And I would think this would be one of the last places we would try to cut, but nothing's going to be easy.
Agreed. Absolutely. Okay. The last question that we were talking about wasn't so much as a question as it was really a story that was shared about how nurses are leaving the profession because of poor working conditions. They feel like there's lack of support, that patients are coming in later for care due to losing their benefits, and they're treating the ERs as a last resort. And that nurses are working through lunch breaks, and they really are doing this because the patients need them, but it doesn't feel like a sustainable solution. Can you comment on that, or can you respond to that just based on the stories that you've heard from other people and your wife and your son about what it's like to be working in the healthcare system right now with this new added layer of uncertainty?
Well, Certainly, this has been a problem for a long time. It's why I backed a number of staffing bills, both when I was in the state legislature and when in the federal legislature, to try to reduce the stress, and sometimes maybe the better word is exploitation of our nurse working force. And it does create this downward cycle, as mentioned in your description, and as I
Mhm.
mentioned earlier, where stressed out people, nurses leave the workforce, and then there's fewer nurses. My wife really saw this during COVID. She used to do short stay nursing, kind of prep
Mhm.
for high volume turnover surgeries. But she spent a number of years in home health, specifically hospice branch of that. And during COVID, a lot of her fellow hospice nurses were facing the stress and worry about bringing COVID home, and they did
Mhm.
feel like they were working too long and too much under extremely difficult circumstances. How do you put on all that protective gear when you're standing on the porch of a home in a rainstorm with no sanitary place where you're supposed to set your bag down? And then the added stress, you're wearing all that gear when you're going in and you're trying to connect to a family and help coach them through this kind of very sacred life passage of dying and supporting your loved one while they're dying. And so as nurses left, her workload became higher and higher, which became more and more stressful. Of course, she was facing the same fears about bringing COVID home to our house and to our children. Yeah, that was brutal, but it's brutal even in the more ordinary times. And the 2024 nursing workforce study said more than 138,000 nurses left the workforce in 2022 due to stress, burnout, and retirement. And sometimes that retirement comes early because of the stress and the burnout. And so it said between now and 2029, so just we're talking over the next 4 years, nearly 40% of the nurses are thinking or intending, I guess intending is the word they use, to leave the workforce.
Mhm.
That's a stunning stat to me, and I certainly hope it's wrong, because if 40% of our nurses, we're not going to replace 40% of our nurses over the next 4 years. I
Yeah.
mean, how could that possibly? We can't train enough. We don't have enough slots to train enough to replace them. And so just, when we lose nurses, it doesn't mean we lose patients. And
Right?
it's like the patients are going to keep coming, and then even more, because some 11,000 of us now hit 65 every year. So it's just a way of saying an aging American demographic. We need more healthcare because we're getting older as a national demographic, but also a lot of our health practitioners are also hitting retirement age, even if they don't quit early or reduce their work early because of stress and burnout. So one thing that I've been doing is leading the effort for Title VIII nursing workforce development programs. Those
Right.
programs help recruit, retain, train, educate our nursing workforce. The last reauthorization was in 2020. I got it passed, but it expires when? 2 weeks from now, September 30th. Same time we're in the middle of this potential government shutdown from the continuing resolution
Yeah.
expiring. So we're pushing forward. It's bipartisan effort. Tammy Baldwin is my partner on the Democratic side, Susan Collins, Marsha Blackburn. Marsha Blackburn's from Tennessee, Collins from Maine on the Republican side. A second strategy was I will be reintroducing the Nurse Overtime and Patient Safety Act to limit mandatory overtime and drop stronger workplace protections. And third, I'm co-leading the National Nursing Workforce Center Act with Senator Lisa Blunt Rochester of Delaware, who just gave her maiden speech right before I came up here to get on the Zoom. And it was a very inspiring first speech in the Senate chamber for her, and she's a pleasure to work with. The bill supports state-based nursing workforce centers like the Oregon Center for
Mhm.
Nursing Workforce Research, and so we'll have the data to make more investments in the right places to strengthen the nursing workforce. So those are three bills I'm working on, and as you all come up with ideas for better strategies or additional strategies, I certainly hope you'll reach out to me and to my team as we try to improve our healthcare strategy, but particularly, of course, very close to my heart, the nursing strategy.
Yeah, thank you. And thanks for mentioning in your support of the Nursing Workforce Center bill as one of the people behind the scenes that have been just trying to like push that boulder up the hill for so many years. Just to even hear you speak about that just really warms my heart, because that's been kind of a strange experience the first time I've ever tried to pass some federal legislation, and I'm really thrilled that that's part of it. Those were all the questions that I have. I think one question that was not pre-approved, but I do want to ask you, and I think that you kind of have already mentioned this, but if you wouldn't mind reiterating it, for the nursing workforce that is in Oregon, what is it that we can be doing? How can we be, what do we need to be doing in the state of Oregon while there is this looming uncertainty that's happening at a federal level? I mean, I am so grateful that you, with the experience that you have, are in that place of that federal level. So you can kind of work on that uncertainty and try to work with all of your colleagues across the United States. But what can nursing specifically be doing in Oregon that might support you, but also support Oregon's health care?
Well, one thing I encourage is for nurses to participate in your union, because it's that collective voice that helps to push back on the power of management. Management is looking at spreadsheets, trying to figure out how to squeeze more, what they may say is efficiency, but it may just mean like forcing you to do more in less time in a more dangerous fashion. I was always struck when Mary was working in short stay surgery, and she'd come home kind of exhausted. She'd say, "Yeah, I saved another doctor today," because they were just pushing to get that patient in. But one, something they had prescribed was in conflict with something the patient is already taking. Or second of all, they had an erratic heartbeat. And if they'd gone forward with the surgery without me slowing them down and getting the patient stabilized, it could have had a really bad outcome. I think, how many times, I mean, do nurses save the doctors from an egregious outcome? All the time. It happens all the time. But I do think it's important to have a collective voice and encourage you to participate fully and in backing up that effort for a union to help carry the case more broadly than any one individual on their own can. Because if you're in alone, it's easy to pressure you, ignore you, fire you, and so on and so forth. But also to keep bringing up these issues, these stories to educate your electeds. At the state legislature, of course, the state plays a huge role in healthcare. So this is this massive partnership between the federal government and the state government, and be present in both settings to if you've never gone down and shared some stories about the challenges you're seeing in the context of pushing for a bill or reform or a staffing bill or something of that nature, it's worth a trip down to Salem to lobby the state legislature. You can have a few representatives do it for you, but I think it's particularly effective when a whole bunch of nurses show up to share their stories collectively.
Very good. All right. Thank you so much. We still have about 2 more minutes left. Did you have any last minute? We're going to give you the last say.
Yes, thank you all. I think you all make the world better one bedside at a time. And in addition, you bring your stories to bear on policies, and a good policy can help millions of people, and a bad policy can hurt millions of people. So taking your bedside experience and helping convert it into also advocacy for a good law or a good policy is really treasured. So
Yeah.
keep sharing your stories. Thank you. It's an honor to partner with you.
No, thank you. And thank you for making the time and coming to talk to us today. And so that's going to wrap things up. I'm going to share my screen for those of you who are not familiar and you would like to join us on a Friday Huddle. I'm going to put up the screen here. There's a QR code that you can quickly scan, and that will take you to the website. If you would like to join us on a Friday morning at 8 a.m., we talk about this and many, many other things. So thank you, Senator Merkley, for joining us. Thank you. Have a great day. And for all of you who joined us today, thank you so much. If you can make it, we'll follow up with this conversation this coming Friday at 8 a.m. Thanks, everyone. Take care.